Our task force continues to focus on the priorities the President's given us. They are testing, mitigation, and supplies. And on the subject of testing, as is evident to people across the country, testing is more and more available every single day. We'll be detailing tomorrow from this podium the progress that we are making on tests. At this day's reporting, 254,000 Americans have been tested and received results in coronavirus tests, with slightly more than 30,000 actually testing positive. There's a bit of an encouraging word in that for every American. Remember, everyone that's being tested now, with the exception of our healthcare workers, are people that have symptoms that make them think they may have the coronavirus. And as our numbers come in consistently, because the 254,000 does not include all the local hospitals or all the local labs in our states, it's working out to be about 1 in 10 Americans who've been tested who thought they had coronavirus actually had it. 9 out of 10 did not. But we'll continue to roll out the testing to provide that resource to the American people. And we're working to make testing happen faster. We expect from word from the commercial labs that we should be caught up on the backlog in testing by the middle of the week. And we are urging today, on the President's behalf, that all labs would prioritize inpatient testing. Let me say again, to all of the commercial labs in the country, you will receive guidance from HHS tomorrow. But on behalf of the President and the White House Coronavirus Task Force, we are urging all commercial labs to prioritize inpatient testing. We want people that have been checked into a hospital that are being treated for what they suspect to be coronavirus to receive those tests more quickly. Also, I'm pleased to report that yesterday the FDA approved an emergency authorization on a new test that should be in production by the end of March. It actually would be a coronavirus test, the results of which come back in 45 minutes. And we're also working, the FDA is working with manufacturers around the country to come up with even faster, more innovative tests. And as we told our governors in several calls this week, governors and state health officials should simply contact FEMA for the latest information on testing solutions. Let me also say, tomorrow when we gather at this podium, we'll be unveiling, with Dr. Bob Redfield in the lead, new guidance for people that work in law enforcement, first responders, people that work in what we call critical infrastructure in the country. It was in early March the CDC issued guidance for people that were asymptomatic or did not have symptoms, but who had been exposed to someone with coronavirus. We gave them guidance about being able to return to work wearing a mask for 14 days. And tomorrow at this podium, CDC will unveil, in cooperation with the Department of Homeland Security, new guidance which will make it possible for people that have been exposed to return to work more quickly by wearing a mask for a certain period of time.